Now this ultrasound study is that of primary gravida, 16 weeks gestation, female length 2 centimeters, and what we are seeing is that this is the urinary bladder, this is the cervix, the vagina. I have aligned the uterus to the vagina, and this is the anterior myometrium. This is fibroid that relates to the posterior segment of the posterior wall of the uterus. And this area that you are seeing is the placenta. This is the placenta. This is the fibroid. And this is the urinary bladder, this area. But this is the fluid, that is the amniotic fluid. This area shows amniotic fluid. This is the cervix. This is the vagina. This is the anterior myometrium. And the fibroid measures 3.0 by 5.1 centimeters and is at the posterior wall, lowermost segment, because from here onwards the cervix is seen. So now if you note that the cervix is a bit dilated and filled with fluid, it's we will not say, you see this is the this is the cervical area. We can see the vagina, but as such the cervix is not seen. It is dilated up to approximately 20 mm. So, or you can say that the cervical canal is dilated up to 20 mm. All of the cervix is dilated up to 20 mm. So this fluid is in fact tracking, amniotic fluid is tracking in the lower segment of the uterus, and this is the reason why cervical canal is dilated up to 20 mm in the 16 weeks pregnancy. Moving further, now when I start moving the probe from the epigastric region and I'm coming down, I see the uterus. This is the uterus. You can see the fetus. This is the fetus, head of the fetus. This is a transverse presentation, not unusual in this age. And this is the abdomen of the fetus. You can see the movement of the arms, the movement of the lower limbs, and at 16 weeks gestational age. Now when I come down here, I do see a globular shaped placenta. This is the placenta. This one. And the placenta measures 8.5 into 4.7 centimeters. Is grade 1 to grade 2, rather grade 2 in appearance. And is with the lower segment of the posterior wall of the uterus, and it's separate from the fibroid, as this is the fibroid. It's separate from the fibroid. Here it is, and it relates to which area of the uterus. Now it is posterior wall, much at the anterior segment of the uterus. posterior wall, but upper segment, because at the lower segment there is a fibroid. Here it is. See, this is a fibroid, and this, when I move the probe anteriorly upwards, here we see the placenta with the posterior wall, but at the upper segment. This is the placental tissue, this is the grade 2 placenta, and this is the fibroid, this area. This is the fibroid. F will be denoting the fibroid. Here will denote the prostate. Sorry, the placenta. Here is for placenta, and F is for the fibroid. Rest. Now the main finding in this patient of concern is nothing. This fibroid is going to say nothing. It's in fact the dilated endometrial canal, and if I am again trying to get the cervix, but what all I can see is that the cervix, only this part is available. So the cervix is dilated. Immediately above the cervix in the posterior wall is a fibroid, and from here onwards we see that this is the fetus. You can see the cardiac flickers. Transverse line. Here you can see the cardiac flickers. So single active alive fetus with cardiac activity. You can see the waveform. And there is no anomaly seen relating to the fetus. So all the issues are those of being relating to the uterus in the form of a fibroid just above the posterior lip of the uterus and the uterine lowermost uterine segment. Here it is. This is the fibroid, and placenta posterior wall, but with the upper segment, grade 2, and the main important finding is that there is dilation of the cervical canal by the fluid that is being pushed from the upper segment into the lower segment, and that's the reason why cervical canal is only visualized. The cervix incomplete is difficult to get. Here we are. You can see that this is the fluid component within this. This is the amniotic fluid. This is the vagina. Here is the cervix dilated, and this is the urinary bladder. The rest of the ultrasound is unremarkable. Thank you very much. Now see this segment. Now this is the cervix, anterior lip of the cervix, posterior lip, the vagina. Rather, I will say this is the vagina. This is the cervical canal. To be very accurate, and see the anterior lip of the cervix being elevated, posteriorly depressed, and the cervical canal dilation with amniotic fluid entering into it, and the cervical canal is dilated up to 13.1 in this scanning plan. Sorry, this is the uterus, anterior myometrium. This is the uterus, the entire parameter, and then this is the uterus, okay, and this band of white tissue that you are seeing among the amniotic fluid is the placenta in this loop. An important finding that should be reported. Here we are. See the dilation of the, because this area is that of the urinary bladder. And here comes the dilated cervical canal. Because of the protuberance of the abdomen, fatty patient. Difficult but not impossible. Okay, now when I proceed a bit further upwards, towards the fundal region, this is the uterine fundal region, and here you will again see a mass of fibroid that relates to the uterine fundal region. Here it is fibroid. You see, this is the lower segment. This is the fetus, a bit pushed downwards, and when I move the probe towards the fundal region, I come across a solid ecogenic mixed ecomass, which is a fibroid in the relating to the region anterior wall. This is the fibroid, same patient, and this is the fetus. And you can see the cardiac activity, the fetal movements. Okay, now this is the fibroid relating to the anterior fundal region. So this is our case of the day. 2 fibroids, 13 mm dilated cervical canal with the amniotic fluid being pushed there, and the lower segment displaced fetus of 16 weeks, but the fetus is normal. Thank you very much.